Welcome to week 10. This week we have 3 PowerPoints to go through, kind of some 3 different little categories of bacteria, not so nicely as fitting as like gram-negatives, gram-positive kind of thing, but just some little oddball, if you will, organisms. So we'll start off with the spirochetes. And so as the name implies, of course, the bacteria that we'll discuss in this is going to be all spiral-shaped or spirochete bacteria. They're very motile, they all have flagella. And so there's really 3 that we're going to focus on, 3 genuses that we'll focus on: Treponema, Borrelia, and Leptospira. So this is kind of the way that they look. They do, even though they're all spirochetes or spiral, they do all have different features. Some are looser spiraled, some are tighter spiraled, but have like more of a hooked end, like the Leptospira here. So they do even look different in that spirochete formation under the microscope. So starting with Treponema, these are considered tightly coiled. They do not stain well. They stain very poorly. They are observed best as a result with dark field or phase contrast microscopy. Only able to be cultured in like a cell culture, meaning we're not going to be able to take in a specimen and just plate them out like normal. So the major pathogens in Treponema are Treponema pallidum, subspecies pallidum, subspecies pertinu, and then Caritium. So here's kind of what they cause. So Treponema pallidum is like the biggest one. That is the one that's responsible for causing syphilis. So that's the one that you've heard of, most likely. And of course, my dogs had to join the conversation. You know, they're quiet up until the minute I start talking. So Treponema pallidum is responsible, again, the subspecies pallidum, I should say, for syphilis. So transmission, of course, is sexual contact, or it can be congenital, meaning from mother to fetus. That does occur in stages. So I believe we will discuss that on another slide. Treponema pallidum subspecies pertinu is causing the disease considered Yaws. And so this is contact with an infected lesion, mainly occurring in children in Africa and South America. So this can affect the skin, bones, and cartilage, and can cause severe disfigurement and disability. And then Treponema caritium is also contact with infectious lesion, but this is causing the disease Pinta. And this is found Central and South America and Mexico. Skin discoloration from hypopigmentation to hyper, and then lots of lesions that can lead to causing disfigurement from those lesions. So here's kind of what the Yaws lesions might look like. So they get quite deep, and then that's where they can go in further into the bones and cartilage as well. So they're not just surface level. Those lesions can become quite deeper. All right, so going back to syphilis, as I said, it occurs in stages. So there's primary syphilis, in which you will see the genital lesion, what we call chancre. So that is genital lesion, kind of giving an indication that, hey, you might have an STD, maybe it's syphilis, but there's a few, STDs that cause, of course, genital lesions. If you do not catch that you have syphilis, screen for it, see the lesion, or go and get it checked, and it just isn't treated, then it could go into secondary syphilis. And so this is where you become ill with fever, weight loss, rash. The skin is heavily infected here as well. And then from there, it can go into tertiary syphilis, in which it can destroy tissues within you. This can even pop up years later. So if this syphilis, this Treponema, has been hanging out latent, you went through the primary, the second, and it's just been hanging out and you have not known it, it can still pop up 25 years down the road. And so because of the tissue destruction, you're going to see significant issues, cardiovascular issues, eye problems, and then central nervous system disease. I know that there's been a few shows that have featured this in it. I remember a specific I think it was Law and Order SVU episode, or maybe it was Criminal Minds. One of those. I love those shows that had a person in there with tertiary syphilis that was going, quote unquote, crazy because of their nervous system involvement. They had tertiary syphilis, had never been treated, didn't realize it, and their central nervous system was affected. So of course, is that 100% reality? No, but like, it's just an example of how they use the tertiary syphilis with the CNS involvement in that show. Okay, so as I said, best seen under dark field microscopy. We can also use fluorescent staining with that dark field microscope. And that's kind of the confirmatory method, is that together. But there are screening methods first for syphilis, what we call the RPR and VDRL. So RPR stands for Rapid Plasma Reagent. VDRL stands for Venereal Disease Research Laboratory. So these are looking for what we call reagent antibodies. So they are flocculation-based tests, or if you want to consider precipitation-based tests. Because again, if you've taken immunology or you are taking immunology, you've learned that precipitation-based is which you have a soluble something forming clumps. So in this case, it's soluble antigen forming clumps and binding to that reagent antibody that it's looking for. And then that would give a positive, and then they would confirm it. And the confirmatory method is using a fluorescent stain with a dark field microscope. So it's called the FTA-ABS, fluorescent treponemal antibody absorption test. So this is what it might look like. So you can see the little spirochete right there. All right, on to Borrelia. So Borrelia is considered a looser coiled spirochete. It can stain well with Giemsa stain, which we use Giemsa a lot with hematology stuff. It is the causative agent of Lyme disease, which most of us have heard of, and also relapsing fever. So you can detect Borrelia through direct observation of it in the blood, PCR testing, which is how we mostly do it now for Lyme disease, and then also an ELISA test for detecting bacterial antigens. So Lyme disease is specifically caused by Borrelia burgdorferi. The vector is the Ixodes tick. And so this is something most people are common with or have common knowledge of Lyme disease being passed by a tick, but it's specifically the Ixodes tick. Of course, this affects both humans and animals. There's 3 stages. The first stage and the first indication of Lyme disease is the erythema migrans, which is a red target-shaped rash at the site of that tick bite. And so that will be seen in about 70% of patients. So majority of patients will have that target rash at the site of that tick bite. Of course, 30% don't. And then along with that, you can have headache, fever, and joint pain. And then it can also evolve into the next stage, which is continued joint pain, arthritis, and neurologic disorders, and then chronic arthritis continuing on for years. You can treat Lyme disease. Of course, it is a bacterial infection, but some people don't always respond the best. It just depends on when they catch it, where they're at with what stages and their body and all that. So found wherever you basically find ticks, especially in the US, so Northeast US, Minnesota, Oregon, California, and then of course into other places in the world as well. Relapsing fever is caused by Borrelia recurrentis. So the way I always remember this is recurring, relapsing. They seem like similar words to me. So that's how I've always kind of remembered them. I don't know why, but the words just seem like each other to me. I know that recurring, relapsing, not exactly the same meaning, but to me it's like close enough. So Borrelia recurrentis. In this case, the vector is lice, specifically the louse Pediculus humanus. So the humans are the only reservoir for this bacteria. So fever, headache, myalgia, which is muscle pain for up to 10 days. And then it can become hidden and then reappear and start another fever period and then become hidden and then reappear. So thus the name relapsing fever kind of is, it's there and then it goes away and then it's there and then it goes away kind of thing. All right. Leptospira is our third spirochete. So as I said in the beginning, this is the one with the hooked ends. It has a corkscrew motility. Leptospira interrogans is the main pathogen. This is very much a zoonotic disease. So you become infected with this through direct contact with the animal itself or through their urine or blood of that animal. It's well known to be linked with like water sources. So if there is urine in that water, and you pick it up from that water source that has been contaminated with urine, that is one way you can also get it. I know like there is now a vaccine for this for dogs. So like if your dogs are ones that you take outside a lot, like hiking, if they're allowed to run free kind of in the countryside, they really recommend getting the Leptospira vaccine for your dogs just because they will have the potential to come into contact with that urine or blood of an animal that might be infected. So when you do get this bacteria, it invades rapidly through the CNS, kidneys, so on. So lots of similar symptoms as some of the others: fever, headache, muscle pain, can become septic because it can get into your blood. There is a form of leptospirosis that's called Weil's disease. That is a very severe form with dysfunction of the liver, kidneys, and vascular system. And then Vincent's disease is also caused by spirochetes that are found as normoflora in our oral cavity or genital tract, and that causes acute necrotizing, oh, there's a spelling error there, Acute necrotizing ulcerative gingivitis, because it can be in the oral cavity, it can have destruction lesions of the gums. So that's just one final mention. So out of this PowerPoint, what I focus on for testing is the syphilis, is the treponema stuff, anything dealing with syphilis, because that is something very prevalent that we deal with in the clinic labs. So STI kind of testing stuff. So I definitely want you remembering syphilis, treponema, the testing with that. Leptospira, the source for that with the water, the urine, all that kind of thing, that it has more of the hooked ends. And then the Borrelia, of course, for Lyme disease and for recurring or relapsing fever. So those organisms that go with that, along with the vectors that pass it. So that's kind of what I stay focused on. I will not test you on the Wales disease or this Vincent's disease. They're just mentioned there for information, kind of thing. All right, moving on to our next set of organisms, Mycoplasma and Ureaplasma. As you can see, it's a very short PowerPoint. There's not a ton to remember. There's just going to be a couple things that we'll focus on. But in general, Mycoplasma and Ureaplasma are put together because they do not have a cell wall. And so as a result, you cannot gram stain them if there's no cell wall. They are tiny, tiny little organisms. So we are not going to detect these with a gram stain in a culture like all the other bacteria. They do require media that have very specialized things in it, cholesterol, fatty acids. When they do grow on that specific media for them, they will have what we call a fried egg appearance. So here you can see the fried egg colony. Truly does look like a fried egg. Sometimes when they nickname things, you never know if they're going to look like it. In this case, it does. Okay, so main characteristics. So the mycoplasmas are normal flora of your oropharynx, your upper respiratory tract, and your genitourinary tract. And so, of course, they can cause disease in where they're kind of found there. So Mycoplasma pneumoniae is probably the one that most people have heard of in general. That's what we call the walking pneumonia. So definitely infecting the respiratory tract. So pneumonia is, of course, a lower lung infection. And then you have Ureaplasma ureolyticum and Mycoplasma hominis, both in which are infecting genitourinary tract. So Mycoplasma pneumonia, as I said, called a walking pneumonia because it's more of an atypical pneumonia. It's not like the pneumonia you might get from Streptococcus pneumoniae. Walking pneumonia is considered more supposedly a milder form, although it depends on the person and your immune system. But it's something like you don't feel good. You can tell you have a respiratory infection. You can tell you're not breathing quite right, but yet you're not in bed, down and out kind of thing. So that's where the walking pneumonia kind of comes about. So 20% of pneumonial infections are considered the walking pneumonia. So bronchitis, pharyngitis can also go along with Mycoplasma pneumoniae. So not just the walking pneumonia part. And then, like I said, hominis and ureolyticum are both in the urogenital tract. So they've been associated with bacterial vaginosis infections. So there it kind of lists that. Mycoplasma hominis, urethritis, which is inflammation of the urethra. And then ureolyticum, same thing. And then lab diagnosis. We can grow Mycoplasma hominis on blood organ chocolate, but it's not commonly done. For walking pneumonia, for the Mycoplasma pneumonia, we're using titers. We're looking for antibody antigen kind of reactions. Ideally, an acute and convalescent titer, meaning that they're drawn like 3 weeks apart. So we're looking at antigen antibody kind of testing, PCR testing as well for any of the Mycoplasma, ureaplasma. If you want to stain them, you can use that acridine orange to stain because, again, these do not have cell walls. You cannot use gram stain. So acridine orange, remember, targets and stains nucleic acids, so DNA. And of course, these have DNA in them. So we can use an acridine orange to stain and detect if they are there. But PCR is probably the best way to go here. All right, and our final PowerPoint is chlamydia, rickettsia, and some other goodies. So here is these organisms. So chlamydia, chlamydophila, rickettsia, aurencia, anaplasma, and ehrlichia. These are all considered obligate intracellular bacteria, meaning they have to be inside of a cell to thrive, to do what they want to do. So these are all found inside cells. As a result, we're not going to culture them like normal because of that. So chlamydia has 3 species. Chlamydia trachomatis is going to be the most familiar to you. That is what truly causes the STI chlamydia. And then we have chlamydia sui and chlamydia myrdarum. And then you have chlamydophila, which contains 6 species. Chlamydophila pneumonia and Chlamydophila psittaci are probably the 2 most common out of those. So going back to chlamydia, the cell wall lacks a peptidoglycan layer. So again, you're not going to be able to gram stain this. They are also intracellular bacteria, so they're found inside cells. So chlamydia trachomatis, chlamydophilia pneumonia, and chlamydophilia psittaci are all 3 of the main pathogens that we are worried about out of this grouping. So chlamydia trachomatis is the most common sexually transmitted bacteria. It is a major cause of pelvic inflammatory disease, PID, which is the STI that it can cause. So lots of pain, inflammation there. It can also cause conjunctivitis infection. So up in the eye, very treatable. As of right now, it's still treatable. So you can treat both the sexually transmitted and also the conjunctivitis that's happening. So that's where it's causing preventable blindness, because it is treatable. Natural habitat is humans, again, spread through sexual transmission, can also be spread congenitally, so upon giving birth as well. So specimen collection, ideally we are doing PCR testing here. So we will swab the urethra, male and female, and test it for typically PCR. A lot of times this is sent in for both a gonorrhea and a chlamydia on the same swab, and they test for both off the same swab when they're doing STI screening. We can do some other serologic antibody antigen testing, but most places just use PCR. Chlamydophila psittaci, this is a huge one in bird species. Parrots and parakeets are especially known to carry this. And so you can get it inhaling aerosols, any sort of touching of anything like those bird droppings, things like that. So you can pick it up that way, anything handling with those birds. And the symptoms here: pneumonia, headache, mental status change, enlargement of your liver and spleen, hepatosplenomegaly, is all going along with what we call psittacosis, which is an infection of this organism. So again, diagnosing it by serologic tests. So antibody, antigen kind of stuff. Chlamydophila pneumoniae, of course, as the name tells you, it's going to cause some lower respiratory stuff like pneumonia or bronchitis, along with some maybe upper respiratory stuff. Transmitted person to person by respiratory droplets. Same thing for lab diagnosis. All right, and then on to some of the others. So rickettsia causes Rocky Mountain spotted fever. The vector here is ticks. Orencia susukumushi causes scrub typhus. The vector is chiggers. We do see chiggers in our lakes in Minnesota. Certain lakes have been known to have chiggers. So that is something just to be aware of. Ehrlichia, I'm not saying that this one specifically is in Minnesota, but chiggers do pass things. So when people swim and get chiggers, I know my nieces, I feel like have chiggers every summer. I don't know how. Ehrlichia is definitely something you'll see in Minnesota, Wisconsin areas locally. And then anywhere that there's ticks, of course. So Ehrlichia is causing ehrlichiosis, and then anaplasma also passed by ticks, same thing, anaplasmosis. You will find both Ehrlichia and anaplasma as inclusions inside the cells. Because again, remember, these are all obligate intracellular bacteria. So when we're doing hematology and you're counting cells under a microscope, you will very much see Ehrlichia and anaplasma in, like, especially the neutrophils, because neutrophils, again, are a big bacterial phagocyte, as inclusions, but you can also see them in monocytes and things like that too. So they're kind of like big purple inclusions in there. All right, the picture here is just showing an adult chigger, and there's a larva chigger. This is all on a pinhead. This is like a little nail or pin. So look how tiny those are. My goodness. And then here's an example of that Ehrlichia bacteria inside a neutrophil. So as I said, nice round purple inclusion. Anaplasma looks very similar as well. So that is one way, by the way, when you are doing hematology and you start seeing that, you definitely want to make note of that so that they can test for them to see if they have Ehrlichia or anaplasma. And then another obligate intracellular organism is called Coxiella, causing what we call Q fever. It's a very systemic infection that really affects the lungs, pass through bodily fluids of infected animals like goats, sheep, and cows. Trophirma whipplei causes Whipple's disease. Again, mainly just detected with PCR. I am not testing you on this. This is just informational. And then one final one, another STD with genital ulcers. There's a bunch of STIs that have genital ulcers. This one is, I can't even say this name very well, Calamidobacterium granulomatis. I will not test you on this one. It's just there for information. So basically just kind of remembering the vectors. I did not go into like all the different like symptoms, things like that, testing. Just know it's mainly PCR testing or like serologic testing. Just keeping in mind what they basically cause for the disease name and the vector is important here. A lot of this is crossed over between immunology. You might learn more about, say, Rocky Mountain spotted fever in immunology. So we don't go heavily into depth here just because these are odd little organisms mentioned. In the scope of everything that we're remembering in this course, we're just going to keep it simplistic for this PowerPoint. All right, so that is it for this week. If you have any questions, please reach out. Thank you.